everybody. This is Congressman Mike Levin. Thank you for joining us for another virtual town hall where we're going to be talking about COVID-19 and quite a bit more. This is our 41st virtual town hall since the middle of March, when COVID-19 really became this unbelievable, unprecedented public health and economic crisis. And I'm so grateful to our team, our live streaming team. Jeremy always does such a great job. Our campaign team that has just been amazing. Adam and Hunter and Ellen and Garrett, all of our wonderful interns and volunteers. I'm grateful to each and every one of you. I also want to say a special shout out to my amazing wife, Chrissy, and our kids, Jonathan and Elizabeth, who started their third and first grade virtually recently. It's been a tough time, but we're all doing very well. And a shout out also to my mom and particularly to my dad, who is celebrating his 74th birthday today. So after this event, I'm going to be having a socially distanced piece of birthday cake with my dad. Love you guys very much. I also obviously wanted to say a few words in commemoration for yesterday, which was the 19th anniversary of 9/11. I'll never forget where I was on that tragic morning. We had a National Day of Remembrance yesterday. It was a day of unity. And we paid tribute to those lost and those injured and those who have served and continue to fight for our freedom. And we're truly grateful to our first responders. We're going to do everything we can in Congress to fight for them. And we've done that this last Congress. We'll continue on that path. I also wanted to say that the wildfires that we're seeing up and down our state and throughout the western United States are devastating. They are unprecedented. And I particularly want to give a shout out to part of my wife's family up in Oregon that have just had a devastating loss with the loss of their family ranch that's been in the family for many decades. We're thinking of you, thinking of my brother-in-law in Portland, and my in-laws out in Arizona. It's just a very difficult time. And if you're like me, you've been stunned this past week by the images of the apocalyptic looking skies here in Orange County and in San Diego County. We've had really poor air quality, but that pales in comparison to what we've seen in other parts of California and up into other parts of the West Coast. So I hope that everyone is staying healthy. And just a couple things. I think, for one, it's a stark reminder that we have to take action to combat the climate crisis. All we have to do is listen to our own scientists, our own experts from local institutions like UC San Diego and the Scripps Institution of Oceanography right here in our district, and they will tell you that there's undeniable linkage between the droughts, the record temperatures, and the fires that we're seeing. Second, I think it's really important that to the extent we're experiencing unhealthy levels of air pollution, we remember that it's particularly risky for children and seniors and adults with heart or lung problems and those who are pregnant. And you can actually check on air quality in your area. There's an excellent federal resource. You just put in your zip code to airnow.gov. That's AIRNOW.gov. And you can see exactly what the air quality is in your zip code, or search for other places as well. And then finally, I hope that you'll consider giving to wildfire recovery efforts. There are many ways to do that, but one that I'll highlight is the California Community Foundation has a wildfire relief fund, and you can learn more about that at calfund.org. That's calfund.org. With that, I am always honored to welcome back Dr. Richard Garfien to visit with us. This is his 15th town hall. We've had 41. He's been here for 15 of them. Truly amazing. Dr. Garfien is an infectious disease epidemiologist, educator, and healthcare innovator who seeks to understand the causes of disease and translate that understanding into impactful solutions. He earned his PhD at Johns Hopkins University and his MPH at San Diego State. Served as Epidemic Intelligence Service Officer and epidemiologist for 7 years at the Centers for Disease Control and Prevention before joining the UC San Diego School of Medicine faculty in 2005. His research focuses primarily on airborne and bloodborne infections, often associated with health disparities and substance use, including tuberculosis, HIV, and viral hepatitis in the U.S. and abroad. His research on digital adherence technology over the last decade informed CDC and WHO guidelines on the use of telehealth for remotely monitoring patients with tuberculosis, and such technology has relevance today for COVID-19 monitoring and patient support. And on top of all that, he has been an absolute resource for our community and our constituents throughout the last 6 months, joining us on Saturdays to talk about the latest with COVID-19 and really inform our constituents with the latest public health information. We're incredibly grateful. Thank you, as always, Dr. Garfi, and it's wonderful to see you.
Congressman, it's a pleasure to be back.
Of course, very sadly, we've passed 193,000 deaths as a result of COVID-19. The United States has around 4% of the world's population, but we've got over 20% of the world's deaths. Truly, truly tragic. We have now about 6.4 million cases in the United States. California has the most cases of any state with over 755,000. We've had 14,270 deaths in California. San Diego County has confirmed 41,969 cases and 730 deaths. Orange County has confirmed 50,613 cases and 1,081 deaths. The big news, of course, I know you'll be talking about this as well, Richard, is that on August 28th, the governor announced the blueprint for a safer economy, basically creating this colored tiered system. And now Orange and San Diego counties are in the red tier, which still means that there are restrictions on certain activities in terms of what sectors can operate and at what capacity. And the metrics that the tiers rely on are the number of cases per 100,000 residents and the percentage of tests that come back positive. And I know you'll be speaking about this more, but we're in the red, and a list of really the types of businesses and what that means is available. The California Department of Public Health put a new website together that you can see at covid19.ca.gov. Again, covid19.ca.gov. And as I've said for months, what we need to do really has not changed. And the tiers now with the colors, that has changed. But as always, the best thing to do is follow the public health guidance. Socially distance, wear your mask, wash your hands, do everything you can to avoid crowds indoors whenever you can. And obviously, just use common sense. And it's not just about keeping yourself safe, it's about keeping others safe. The other day, I saw somebody on TV and he wasn't wearing a mask. I said, "Why aren't you wearing a mask?" He said, "Well, if I die, I die." And I thought, how short-sighted and selfish can you be? It's not about just you. It's about the other people around you and keeping them safe as well. As we know, the disease can be transmitted asymptomatically. I'm going to keep doing whatever I can to help our district, to help our country get through the public health crisis, get through the awful economic toll that this has all taken. And I've said straight through that the only way we're going to have a healthy economy is if we have healthy people. And so tomorrow I'm heading to Washington, and I personally remain hopeful that we can achieve something that many people are saying cannot be achieved, which is bipartisan compromise, even during this difficult time. We did it 4 times before. All the way back on March 6th, we passed $8 billion for a vaccine. And that vaccine development and that money has gone a long way, and we see the progress that has been made. Then in the middle of March, the Families First bill, $200 billion for nutrition assistance and emergency sick leave. But how intolerable is it that 1 in 4 children in the United States of America are food insecure? It is unacceptable that we have a higher rate of food insecurity among children than any other Western democracy. And we've got to do more for food insecurity. Just the same, at the end of March, we passed the CARES Act, $2.2 trillion. Everything from the Paycheck Protection Program for small businesses, direct cash assistance of $1,200, the $600 a week in expanded unemployment insurance, And then, of course, the money for our state and local government, $150 billion. The money for our hospitals, for our higher ed, for our K through 12. But that money simply wasn't enough. At the time, we felt it would be. But we did not anticipate that this would still be going, and that now in the middle of September, we would be looking at almost 200,000 that had died from COVID-19. So this is no time to take our foot off the gas. This is a time for us to continue to negotiate and to try to come together and do something for the American people. Now, 4 months ago, in the middle of May, the House passed the HEROES Act. That was our fifth bill that we passed, $3 trillion plus bill, over 1,800 pages. It would provide for an additional $875 billion for state and local government, including $300 million for the cities of the 49th district. And that's something that was supported by all 9 mayors of our district, including the Republican mayors. That need for the state and local funding is absolutely, it's so critical. The state and local budgets are having all kinds of trouble right now. And to say that the problem is only a blue state problem ignores the reality of the facts on the ground. The virus doesn't care if you're a Republican or a Democrat. The virus doesn't care about anything else besides spreading the virus. And we've got to recognize that this is not a red state or a blue state issue. This is something that's happening all across the United States. The HEROES Act also had far more assistance for people who are really at most in need. It would save lives through a national testing strategy and money for contact tracing. And how disgraceful is it that here we are in the United States of America and there are people who are contracting COVID-19 and they wind up with medical bills for tens of thousands of dollars. Treatment for COVID-19 should not be cost prohibitive. It should be covered. It should be free. The same with the vaccine once it becomes available, and the same for testing as well. And here we are 6 months later, and we still don't have a national testing strategy to this day. It's absolutely unbelievable to me. And there are even some who are embracing this concept of herd immunity, which, as I've said, is not a strategy at all. It's the abdication of responsibility and essentially giving up. And, you know, we now have heard the tapes from the President of the United States himself saying at the beginning of this that, well, he had the information, knew the national security challenge that it was, knew how deadly the virus was, that he didn't want the American people to panic. But when I heard that, I thought, how cynical can you get? Because the American people, if given the facts, if given the data, have demonstrated time and again throughout the 240-year history of our country that we can come together and we can solve big problems. We don't panic. I think we're resolved in the face of crisis. And I think we would have come through this just as we've come through other great challenges facing our nation. So all we expect is that our leaders actually will level with us, will tell us the truth. I don't think it's that much to ask. So here we are. We've had 4 months. We sent the HEROES Act to the Senate. 4 months of inaction for Mitch McConnell and from the Senate. And then they, on a 52 to 47 vote the other day, they got 52, but they didn't get the 60 they needed to pass this latest bill. And this latest bill was designed for nothing more than to check the box for those Senate Republicans, particularly those in difficult states, Colorado, Arizona, Montana, Maine, North Carolina, for those vulnerable senators to be able to say that they did something. But McConnell and the Senate knew that that bill contained poison pills, that it would never even meet the minimum threshold for what we in the House would be willing to do to actually meet the lives and livelihoods of the American people. Moreover, the sad thing is that we have said that we would negotiate, that we would meet them in the middle. And you know, my colleague Jim Clyburn of South Carolina has a great expression about this. He says, if you're 5 steps away from that other side when you're negotiating, you'd be willing to go 2 and maybe even 3 to meet them in the middle, but you're not going to go all 5. And that's all we're asking. Meet us in the middle. We've tried to be more than reasonable about it. Meanwhile, the Republicans have been in disarray. Mnuchin has said that they would go up to $1.5 trillion in their bill, in their proposal. Meanwhile, the Senate actually took a step back. They went from $1 trillion to $0.5 trillion. And so if we're at 2.2, which is what we said we would do, we'd go from 3.4 to 2.2. And if the White House is at 1.5, my hope is that calmer heads can prevail and we can work within those two numbers and we can get something done for the good of the American people and to save lives. It's not too late to save lives. I know Dr. Garfien believes that. I certainly believe that as well. It's never too late to act when lives are on the line. And they most certainly are right now. So we've got to do everything we can. And that's why I'm going back to Washington. I hope that everybody considers the gravity of the situation, the fact that it doesn't have to be nearly as bad as it's been. If we fail, however, to take the steps to protect people, it's only going to get worse. It's only going to get worse. So that's my great hope. I also wanted to talk for just a minute about the work that we're doing for our veterans. I have been so incredibly honored to chair the Veterans Affairs Subcommittee on Economic Opportunity. And through our committee, I have helped introduce 19 bipartisan bills. 13 of them have already passed the House, and 4 of them have been signed into law by this president. So it's an example that even in this crazy environment where it seems as though nothing is getting done on a bipartisan basis, we have been able to work together for our constituents, for our district, and help our veterans. And I thought I would just explain those 4 bills very quickly. First, in August, just last month, President Trump signed the Ryan Cools and Paul Bene Specially Adaptive Housing Improvement Act, which I led with my friend from Florida, the ranking member of my subcommittee, Gus Bilirakis. The bill updates the Department of Veterans Affairs Specially Adapted Housing Grant Program, which provides money for veterans with certain permanent service-connected disabilities, such as bilateral amputees and paralyzed veterans. The bill increases the funding available to these veterans, increases the number of applications the VA can approve, extends the benefit to blind veterans regardless of whether they have lost a limb, and allows eligible veterans to access the funding for 6 times instead of 3. The second bill that's now law, also signed in August, President Trump signed our bipartisan bicameral bill amending the Service Members Civil Relief Act, SCRA, to provide additional legal protections for service members impacted by COVID-19. The bill expands protections to service members who were previously issued orders to change duty stations because of COVID, but received a stop movement order and may have a housing or car lease in 2 different locations. Third, last July, the president signed our bipartisan Protecting Affordable Mortgages for Veterans Act that made changes to help VA home loan marketplace remain liquid, stable, and affordable for our nation's veterans. And then finally, last July, the president signed a bill that I wrote along with my friend Andy Barr of Kentucky to expand veterans' access, to expand GI Bill eligibility for STEM scholarship programs, science, technology, engineering, and math. All 4 of those now law. I'm very proud. And I hope that we're going to have at least another big one coming up in September. We're working very hard on another one. So look, again, at a time when it seems like Washington is broken, and if you only watch cable news, I don't blame you for thinking that. We are getting things done. I have tried always to find common ground, to move forward common sense proposals for our district consistent with our values. So with that, I want to turn it over to my good friend, Dr. Garfien, for an update on COVID-19. Good to see you.
Thanks, Mike. Yeah, so I was just kind of thinking about where we're at now. We've had the pandemic with us for over 6 months, and we're learning more and more about how the virus is transmitted and what kind of disease it causes and what it looks like in human beings. And as we're starting to get ready to go back to school and going back to work, and I know we're all really tired of it, and we're trying to get back to some semblance of normal as quickly as possible. I thought it would be a good idea to sort of rehash what we know about how the virus is transmitted, to sort of reset what we're thinking. I know there's a lot of information floating around out there, a lot of questions. The messaging from our institutions like the CDC and the World Health Organization and the NIH have changed a little bit over time. And that's to be expected because this is a brand new disease. We've never seen it before. We have some ideas of how it's transmitted because we have a lot of experience of investigating outbreaks of other diseases. And so we start with that foundation of information, but we still learn about each new disease and exactly how it operates because they're all a little bit different. And so because of that confusion, I thought it wouldn't be a bad idea to go back and just address a little bit of the basics and make sure that people have that in their mind as they're starting to go forward and thinking about, hey, I'm about to go to a party, or I'm about to go to a restaurant, or I'm about to send my kid off to school. What do I really need to be thinking about? And so just what we initially thought about the way that the virus is transmitted was primarily something that we call fomites, and that's when somebody who's infected coughs or sneezes on a surface or touches a doorknob or a keyboard, and then somebody else comes along and they touch that and they pick up some of the virus and then they put it in their eyes or their nose or their mouth and then they become infected. And that is a real way to get infected with coronavirus, just like it is with the common cold and flu viruses. And so it's something that we have to be careful of, and it's a reason to keep our surfaces disinfected. However, what we've learned is that's not the primary driver of this infection. The primary driver is airborne spread. And airborne spread consists of two things. It consists of droplets, which are larger, heavier particles that can sometimes be seen with the naked eye. And they're heavy, so they sort of fall to the ground after a few feet. And that's kind of how we came up with the idea of the 6 foot distance for social distancing. But then there's also aerosols, and these are much smaller and lighter particles, and they can't be seen with the naked eye. And they float further distances in the air, and they're so light that they actually can stay suspended in the air for minutes to hours. And so we have to think about both of these. And so initially we were actually thinking that the main driver of transmission were these droplets, because when we looked at who was getting infected, usually it was somebody who was in close contact with another person. So, maybe it is really the droplets that contain most of the virus, and that's what we have to worry about. However, we've seen some examples now. There was an outbreak that was investigated in China from a restaurant where they mapped out where all the patrons were sitting, and they knew that there was a case at one table, and they looked and they saw that people 2 tables away were infected, and people at another table next to them became infected from this individual. And they were obviously further than 6 feet away. Now, they did also notice that there was an air conditioner that was blowing wind in a certain direction, and the people that were downstream from the case were more likely to become infected. But this clearly meant that it was not just droplets that were transmitting. And then a more compelling case was an outbreak that occurred in southern Washington, where a choir of 61 people got together for a 2.5-hour choir practice, and one of the choir members was infected but didn't know it. They weren't feeling sick yet, but they were infectious. And after the 2.5 hours, it turns out that 52 of the choir members became either confirmed cases or probable cases, and 2 of them actually died. And several of the people that were in this choir were not actually in close contact with that choir member who later was found to be sick. And so this is an indication that when you're in a closed space and you have people that are talking or singing or shouting, as in the case of it being in a restaurant and trying to talk over the music and all the other people talking, we're spreading this virus, and it can travel more than 6 feet. So, based on this epidemiologic evidence, it's really become clear that it's a combination of droplets and aerosols. We really have to think about the air that we're breathing and what amount of virus is in that air. So what I like to think about is if you're in a closed space like a room and somebody's smoking, the first thing you see when they exhale is you see the smoke particles, and that's visible. But you could be clear over on the other side of the room and the smoke dissipates, but you still smell it. Well, those are the aerosols. Those are the really small particles that have traveled across the room to your nose. Now, if you're across the room, you might not be exposed to a lot of virus and you might not actually become sick. But if you sit in that room long enough and that person's on the other side and they're continuing to exhale or talk or sing or shout or sneeze or cough, the amount of virus aerosols that contain virus in that room start to build up. And so that's why we have to think about not just the proximity, but the duration of time that you're with somebody. So what this gets to is the issue of dilution of the air. If you're outside and there's a lot of air, think about being in the ocean. If you're in the ocean and something's in the water, it's going to dilute it away really fast. If you're in a pool, it's not going to dilute away as fast. And if you're in a bathtub, it's not going to dilute away at all, and you're going to be sitting in it. So it's the same thing with this virus. So what we want to do is think about what's our surroundings. If you're outside and you're not directly next to somebody, chances are you're not going to be coming in contact with any virus. But if you happen to be, at a party with somebody and you're at a close distance and you're talking, you really do want to have some sort of protection. And then if you're in any kind of a closed room for any amount of time and there's people in there that are talking or breathing, it's really advisable to wear a mask. It doesn't matter if you're 6 feet away. Eventually, that amount of the virus in the air that everybody's breathing is going to start to build up. And so that's why we highly recommend that for schools, they're opening doors and windows to let fresh air in, or to have a ventilation system that's constantly replacing outside air with inside air, so that we don't allow that amount of aerosol to build up in the classrooms. But this sort of brings me back to the issue of masks. Now, we know that masks are not 100% effective. And so there is some aerosols, some particles that are going to go through the mask or around the mask, but they help. They might prevent about 40 to 60% of the virus from being expelled or inhaled. And if everybody is wearing masks, both the people that are infected and the people who are not, then it reduces the chances that you're going to inhale any virus as well. The other thing that we're learning is that the amount of virus that's inhaled at the time that you're infected actually correlates with the severity of the disease. So if you could prevent some of the virus from being inhaled, even though you get infected, you might actually have a less severe infection. So this brings me back to the whole issue of masks. We wear masks because most of the infection is asymptomatic. We don't even know that we're infected. And so we want to make sure that if we just happen to be infected and don't know it, we're not exposing other people by wearing a mask and protecting our community. And we also want to wear a mask because there is some protection for ourselves, either to prevent infection altogether or to minimize the severity of that illness. So my closing there is we need to continue being vigilant. We need to wear masks. Hopefully this helps people to understand a little bit better about how the virus is spread in the air, so we can make some conscious decisions. And it's not an either or, you're either a mask wearer or not a mask wearer. It's really about understanding how this virus is spreading in the community and when and where to wear a mask and do it correctly and do it consistently.
Outstanding as always, Doctor. Thank you so much. Appreciate it. And we've got a bunch of questions. And again, if you've got questions, you can put them in the Facebook feed, or you can email them to us. But we've got a bunch here, and I'll start off. Taylor in Oceanside asks, how close is Congress to extending unemployment benefits, and how much compromise is happening between both parties to get a bill passed? Well, it's what I said at the outset. I am hopeful. A lot of my colleagues are pessimistic, but I think at the end of the day, these circumstances are so overwhelming. And if my colleagues are like me, and we've got constituents that are truly struggling, we know that we need to get this done. I was speaking with the doctor before we got on that the recovery is really a K-shaped recovery, in the sense that if you are able to work from home and you've kept your job, and moreover, if you're invested in the stock market, you're probably doing pretty well. You can't do all the things you want to do, but from a financial standpoint, you've probably been okay. But that isn't the majority of the American people. Most people are struggling right now. That's what the data demonstrates. A lot of people out there are barely making it. We've got 28 million on unemployment, and tens of millions more that are on the precipice of not being able to pay their bills. And so we've got to take action to meet the needs of the American people to get through this crisis. And I'm very hopeful. I think the biggest impediment, the biggest challenge is that we've got around 15 to 20 Republican senators who don't want to do anything at all. They just see the $3 trillion that we've spent. And look, it's a huge amount of money. And it's a big problem. The fact that our deficit to GDP ratio for the first time in decades is over 100%. That's a huge problem. But I would also say that these are highly unusual, unprecedented circumstances, and that we've got to stand up and meet the moment right now. So I'm going to do everything that I know to do to talk to my colleagues on both sides of the aisle in the 3 weeks ahead, 4 weeks ahead, as we try to get something done. The other thing that I'll mention is that right now we have also got to get our government spending bills through. Otherwise, we're going to wind up with another government shutdown at the end of September. So I'm heading back to DC, as I mentioned, tomorrow, and making sure the government doesn't shut down in the middle of a pandemic is another thing we've got to make sure we get done for our constituents. Elena and Del Mar had a similar question. Why didn't the Senate Democrats go along with Mitch McConnell's relief bill? Now we have nothing. Well, again, I think it's important that we actually explain what that bill was. It was never intended to actually become law. It was intended to give a check-the-box vote to some of those vulnerable Republican senators. We remain completely committed to meeting the Senate halfway, as we've said time and again, and I hope that that happens. Here's one for you, Dr. Garfien. This is from an elementary school teacher. They say, I'm a teacher, and we're going back to work in 2 weeks. The teachers and staff just received COVID testing, but the plan is to only get the test once. I'm worried about my exposure during the following weeks when we're not tested, as I'm going to be around lots of kids and staff who might be asymptomatic. And we didn't have the name or the location. I imagine that teacher did not want for anyone to know who they were. But what did you think of the question?
Well, I imagine that teacher is asking the question that a lot of teachers have in their mind right now. So I think it's a very valid question. The CDC doesn't recommend universal testing of all students and staff. The CDC's interim considerations for K through 12 administrators for COVID testing advises that schools should determine, in collaboration with their local health officials, on whether to implement testing strategies, and if so, how best to do that. So the state of California is recommending that teachers be tested when they first come back to school, and then about every 2 months, or a quarter of the teaching staff every 2 weeks. But they really sort of comes down to what's being implemented at the local level. And to be perfectly honest, I wasn't able to sort of find a clear answer on what each school district is doing. So I would recommend for any teachers or staff that you speak directly to your school administrators or the superintendents and find out what the policy is. You know, the good thing for our teachers is that they're employed, and so they have health insurance. And so if they do need to get tested, they should be able to get tested for free, or, you know, have it covered. And if you feel that you've been exposed, either you know that you've got a child in your classroom who's infected, or maybe even outside of the classroom. Maybe you were at a restaurant, or you went to visit a relative and you found out later that they're infected, you want to protect your classroom, then you can talk to your doctor about being tested. But in addition to testing, an important thing to remember is that if you develop symptoms, don't go to work, call your doctor and find out about getting tested. Also, if you know that you've been in close contact with someone who has coronavirus, it may be necessary to quarantine until you find out whether or not you're infected. And so there's some personal responsibility there to make sure that you that you pay attention. And if you think that you've been exposed, avoid exposing the children and others at the school by quarantining and getting tested when you can. The other thing is, remember to wear your mask, because that's a great way to prevent transmitting the virus to other people if you may be infected and don't know it because you're asymptomatic.
Stuart in Cardiff asks, the Department of Veterans Affairs has voiced its opposition to provide dental treatment for all veterans. What can we do about this? Stuart, I know that's frustrating. I know our committee is frustrated about this as well. and we actually have a bipartisan bill, the Vet Care Act, that would authorize the Department of Veterans Affairs to furnish administrative support to a dental care provider that provides services to a veteran that's currently not covered by VA benefits. The bill also requires the VA to implement a pilot program to provide free outpatient dental services and treatment, related dental appliances, and so on to our eligible veterans. So this is something that I have heard from many of our veterans. We've got to do everything we can to get this to become law. And of course, it's tough when Secretary Wilkie, VA Secretary, doesn't want it to happen. But we're going to keep fighting. And ultimately, maybe with a new VA Secretary, we will get that done, along with all the other things we want to do to provide better quality care for our veterans. Thank you for the question. Here's one for you, Doctor, from Mary in Carlsbad. How in the world are we going to trust a vaccine when you have the president trying to fast track the vaccine before all the studies have been completed? Doesn't it take years to produce an effective vaccine?
Well, clearly this is the fastest vaccine development cycle the world has ever seen. And we should be thankful that the machinery for discovering vaccine candidates has already existed, so we were able to take up the charge when the need arose. As a side note, I want to put in a plug for funding scientists who are working on even what we think of as esoteric questions, because you never know when their discoveries might become relevant. For example, scientists trying to find a vaccine against coronaviruses that cause the common cold were sort of scoffed and laughed at, and they had a hard time getting funding because everybody thought, well, it's just the common cold. Well, it turns out that now we have another coronavirus that is deadly and is highly infectious, and thank goodness we have people that had spent part of their career learning how to deal with coronaviruses. So that's my plug for research funding. So there's a lot of things that can be expedited in this process of developing a vaccine. And those are things like fast tracking the FDA review process so that clinical trials can begin as soon as possible. There's a lot that goes into the review of the data that lead to these trials. And normally there's a cycle, and it takes months to get a protocol reviewed so that then it can be approved to move ahead to the next step. Well, the FDA has done a great job of putting these vaccine trials at the top of the list so that they get reviewed quickly. That's one way that you can expedite the process. Also, the pharmaceutical companies have started manufacturing millions of doses of vaccine before they even know if it's effective. And that's with the help of the US government agreeing to help pay for those vaccines, so that if it turns out that they're not effective, the pharmaceutical companies aren't out all that money. But if they are effective, then we already have a head start on the manufacturing process so we can get those vaccines out as quickly as possible. And then the third thing that's going on is that the CDC has encouraged the states to start developing vaccine dissemination plans so that then when the day that the vaccine is released, they already have their plans in place for getting the vaccine out to the clinics and knowing who should be vaccinated first and what the priorities are and getting that process started. So there's a lot that's happening right now, none of which is going to jeopardize the safety of the vaccines. The vaccine trials themselves, those are the things that can't be sped up. The designs have been worked out so that they can be done as expeditiously as possible. But once you actually start that randomized controlled trial and you put vaccine in some people and a placebo in the other, we really just have to wait for those people to become exposed and to count up the number of cases and see whether or not the vaccine actually was protective. That's the part that we can't speed up. And scientists are very adamant about keeping an eye on that science to make sure that they aren't being done inappropriately and that the data aren't coming out sooner than they should be. And let's hope that happens. I mean, if if the president wants to release a vaccine before the trials are finished, that's on him. I think that there's going to be a lot of people that are going to push back on doing that. But I think the process of trying to get these trials done quickly so that we have the best evidence to show safety and efficacy are being done. They're being done appropriately. And we just have to hope that the process works its way out and that those vaccines are ultimately safe and effective.
Well, we all want the vaccine as quickly as possible, obviously. And, I think it's important just to remember that back on March 6th, the bill that we got done on a bipartisan basis for $8 billion led to a lot of the investment in things like Operation Warp Speed that allows for the mass production of multiple vaccine candidates prior to the finalization of the phase 3 trial. That'll hopefully lead to a lot more people being able to get it quickly. I also think it's important that we state that the Trump administration only wanted $1.25 billion in new money back then, and we had to fight to get that up to $8 billion. The other thing is, all I know is if the vaccine announcement comes around November 1st, 2nd, I'm going to be asking you, Dr. Garfien, not just trusting the president with whether or not it's safe and effective. But I've been encouraged by what I've heard from the NIH and others about how they're really, in CDC where you used to work, how they're really going to make sure that they get it right. And also the 9 companies that are manufacturing the vaccine all coming together saying that they are going to collectively fight for the safety standards to be upheld. Then I think the other thing we're going to have to think through is the equity for distribution, making sure that everybody who needs the vaccine gets it and that it's free and distributed equitably. So a lot of things we're going to have to deal with in the coming months. But those are good problems. If we have a safe and effective vaccine in terms of distribution, it's a problem I think we'd all be very happy to have right now. Julie in San Clemente asks, what can the federal government do to help states with the challenges they face regarding online school? Well, Julie, not to be a broken record here, but we had that money in the HEROES Act. We just need for that provision to become law. We had money for K through 12 for higher ed to help them, and that's both to help them safely reopen in person, but also to provide the additional resources necessary to do online. And I want to, again, I've thanked our teachers before. I want to take the opportunity again to thank them. I've personally experienced over the last few weeks how they've been able to help our son and daughter via those Chromebooks. And, it's not ideal by any stretch of imagination, but everyone is doing the best they can until we can safely reopen in person. So I'm grateful to all of our teachers again. Here's a question for you, Doctor, from Susanna in North County. Susanna says, I have a teen son with special needs. They're starting back to school next week before the other high school students. However, there will be students who are medically exempt from wearing masks and exempt from social distancing. I'm worried about my son being exposed.
Yeah, I've heard that question quite a bit. Looking at different websites for the various school districts, for example, the Oceanside Unified School District website says that students with sensory and cognitive behavioral needs will not be required to wear facial coverings. However, they will be encouraged to wear face shields to the greatest extent possible. I recommend that parents in this situation talk to their school administrators and find out what will happen in their specific situation. How is it going to be handled in their class? It's really hard to generalize because every school is different and they have different sets of kids in different environments. And so it's really important to talk to your own school district and be frank and say, I'm concerned about this situation. How is this going to be handled? Is my child going to be safe? Some general advice on things that you might want to ask about are how many students will be in the class? Is this a class of 20 students, or will they downsize the classes for the special needs kids, which hopefully they will be. Also, how close together will the students be with each other and with the teacher? Does the classroom have plastic barriers to separate the kids from each other? What about the ventilation in the classroom? Do they have a good ventilation system that's replacing the outside air with the inside air frequently? And does it have a good filtration system? It should have a MERV rating of at least 9 and preferably 13. Will part of the day be spent outside so the kids are spending some time in fresh air and letting the classroom air out? It's like I was talking about with the aerosols. We want those rooms to get some fresh air. Also, how often are high-touch classroom services like desks and doorknobs and the like, how often are they being sanitized? And then finally, where will lunch take place? Will the kids be eating in the classroom? Will they get a chance to go outside and eat? Lunch is when kids are going to have to take their masks off. And then finally, your son should be wearing his mask, especially around those other students who are unable to wear a mask. Not only does it protect your son, but there's always a possibility that your son might become infected, and now he could infect those other vulnerable kids who can't wear a mask. So mask wearing is important. It protects your son as well as protecting those other kids in case, God forbid, your son should get infected.
Thank you, Doctor. Robert in Solana Beach asks, why has the stock market done so well during the past few months while millions of Americans are out of work and struggling to gain income? Well, Robert, I think it's pretty clear that what happens on Wall Street does not necessarily reflect what is happening on Main Street. In other words, the performance of the stock market and our overall economic situation are not one and the same. According to the most recent data from the Fed, the top 10% of wealthiest Americans own 87% of the value of the stock market, and the top 1% own over half of the value of the stock market. So as I mentioned before, we've got a K-shaped recovery here, where again, if you're invested in the market and you're able to do your job from home, or you're otherwise well off, you're doing fine. But on the other hand, if you're like most people, and we know statistically from recent studies that have come out, there was just a big report in the Los Angeles Times recently on this that looked at major centers, urban centers, population centers across the United States, showed over half the people out there are really struggling to pay the bills right now. So as I mentioned, in addition to the 28 million that are on unemployment insurance, we know that there are significantly more, additional tens of millions, that are right at the precipice of not being able to pay their bills, not being able to make their rent or pay their mortgage or keep food on the table. And that's why it's so critically important that we do everything we can to help right now in this time of need. Thank you for the question. Here's one for you from Bruce in Dana Point, Doctor. And actually, I agree with this question. I'm curious myself. My doctor wants me to get the flu shot now, but I usually wait until October or November. Is the flu shot ready now for this year's flu? Will it last throughout the whole flu season if I get it now versus later this year? And I was wondering about this myself. Should I get my flu shot when I go back to D.C. for the House Attending Physician's office to give me the flu shot, or should I wait?
Well, ironically, we just had this conversation last night with some friends of ours, and my advice is get the flu shot. Okay. So the seasonal flu shot is available now in San Diego County. I just talked to my healthcare provider this week to find out when the flu clinics were going to be open, and I found out that rather than having walk-in flu clinics like they normally would have, because of coronavirus, they're automatically offering the vaccine to anybody that comes into the clinic for any reason. So this is sharp. I'm not sure what Scripps and some of the other healthcare providers are doing, but check with your provider. Most of them, I believe, have the vaccine available now. And so if you happen to be going to the doctor for any other reason, it's a good time to go ahead and get it. If not, make an appointment to do it. Also, many of the pharmacies, CVS and Rite Aid, are offering vaccines. And there are some drive-up vaccine clinics as well. So check with your provider and find out what's available. Normally the flu season can start as early as October. It really sort of peaks around January and then runs through the spring. And so normally there's not a big urgency to get the vaccine this early. However, and part of the reason for waiting is that there is some waning of that immunity over time, but it hasn't really been shown to affect the likelihood of protection during that year. So, studies that have done where they've looked at people that have been vaccinated in like July and August, they start to see a little bit of waning by the end of the season. But clearly we're beyond that. So I think it's safe to go ahead and get your vaccine. And the other important thing is that if you get the flu, it's going to be very difficult to know whether it's the flu or coronavirus. And so if you can get this one taken care of and avoid it, then it really sort of simplifies the issues when it comes to coronavirus. So get it, be done with it, and let's not make the flu something that you have to worry about this year.
All right, my wife's going to be on my case to get it next week. We'll do it. Martin in San Juan Capistrano asks, I read that during the pandemic, over 5 million Americans have lost their health insurance. Will anything be done in terms of an emergency Medicare expansion, or will government subsidies be given to healthcare companies? Well, I don't envision the parties being able to agree on something like that. But well, I think what we really need more than anything is for the administration to stop their attacks on the Affordable Care Act. I mean, it's really quite remarkable that in the middle of this pandemic, where we've had millions of people that have lost their employer-provided health insurance, where we have at least 500,000, I think the number is much higher, that have tried to get on the ACA exchanges, that the administration would continue to undermine the Affordable Care Act in the courts. And regardless of what the president may say, watch what they're doing. And what they're doing by going after the ACA is undermining coverage for those with pre-existing medical conditions. There are about 129 million Americans that have a pre-existing condition. And oh, by the way, COVID would become a pre-existing condition potentially down the road. And I think it's ridiculous that you would not be able to have healthcare coverage because you had COVID. It's exactly the wrong thing to do. So it's unquestionably crazy to me that they would continue their legal assault on the Affordable Care Act. And remember, they have been trying to undermine the ACA now since it was created. They've had 11 years to have their alternative plan, and they still have not developed a concrete alternative plan 11 years later. So I'm going to keep fighting to protect and expand the ACA and to protect and defend Medicare, period, full stop, always. And I hope that, again, we're able to have calmer heads prevail about this in the middle of a pandemic in particular. Here's one for you, Doctor. This is from Gina in Encinitas. What are schools going to do if someone gets the coronavirus? Are they or should they close down again, or just that one classroom? And how will schools be able to tell the difference between a common cold and the coronavirus? Great question.
Yeah, those are really good questions, Gina. Thank you for that. So all districts are making individual decisions with respect to the CDC guidelines and advice from their local health departments. So you really need to check with your local school district or go to their website to find out what their plan is. But I can tell you what a number of school districts are doing is that they're planning to have their classrooms formed in cohorts, or some people refer to them as pods, where the same students and teachers stay together throughout the day, and they don't mix with other groups. In elementary schools, these are typically the classroom. In the middle school and high school, it might be because these students are taking multiple classes taught by different teachers. The cohorts might be a group of students going to certain classes. But the idea here is that if a child or a teacher or staff member becomes sick or tests positive for coronavirus, the idea would be to quarantine that cohort as opposed to trying to shut down the whole school. And this should help to sort of keep the schools open while still protecting those people that haven't been exposed. And the idea being that if a single cohort is exposed, that cohort gets quarantined. If there are multiple cohorts that are exposed and multiple being quarantined, it may be necessary to shut down that school. And in some districts, if there are multiple schools that are being closed down because of cases, then the district at that point might decide to close. So the idea here is that we want to try to keep the schools open as long as possible. And the way to do that is for everybody to be as careful as possible with trying to minimize the chances for spread as they can. Now, there's also another component of this, which is how much disease there is spreading in that community. If the incidence of disease in your community is low, then presumably the cases that are occurring in the school won't become a problem. But if there if the incidence in that community starts to rise, even if you don't have a lot of cases in the school yet, it might be necessary to shut down the schools as well as businesses to try to minimize the interaction between people to reduce the risk of spread. So that's a plan that a lot of schools are working with right now. I think it's a good idea, but to be sure of what your school will be doing, I recommend talking to your school district.
Thanks, Doctor. Appreciate that. And I also appreciate all the hard work of our superintendents and our principals and of course, our teachers and everybody working at our schools. I've now had multiple discussions with virtually all of them. And I know everyone is trying to get this right. And it's a tough thing to figure out the exact way to open the school right now. So I know we'll be keeping a close eye on this, and our thoughts are with our students, our teachers, and our administrators, and all of our employees at those schools in the weeks and months ahead. Susan in La Jolla asks, the pandemic has destroyed millions of jobs, but do you believe that it will lead to new and unique jobs being created? I hope so, Susan, and I'm going to fight for that. I think that the Great Depression and what happened with an investment in public works is potentially very instructive. I think we have a choice to make in the wake of the pandemic, which is whether or not we want to be more like Herbert Hoover or more like Roosevelt and invest in public works and infrastructure. We know that we need major investment in infrastructure in order to be globally competitive. And we know that it will put millions of people back to work. So I think we ought to do it. And I think if we invest in infrastructure the way that we propose in our Moving Forward Act, H.R. 2, that passed the House, I think it'll be a great, great thing. And we know that that sort of investment will lead to growth and will lead to long-term economic stability. And I'm hopeful that we'll be able to move it forward, no pun intended, with Moving Forward Act, H.R. 2. Thank you for the question. Adam in San Clemente, interesting question here, Doctor. Would you say that the risk of voting in person or dropping off your ballot at the registrar is about the same risk as going grocery shopping in person?
That's a good question. I think, it should actually be lower risk than going grocery shopping, certainly no more risk. And I think that the way to think about it is that you want to look at the circumstances at your particular polling place. So, poll workers and voters should all be wearing masks. Voters should line up outside and be physically distanced while they're waiting in line to try to minimize the number of people that are actually inside of that building at the same time. Polling places should have good ventilation with ample supply of outside air, either by turning on fans or turning on the air conditioning and getting the air circulating. And then if there's all the high-touch surfaces like pens and clipboards and voting booths and things like that, they should be disinfected frequently. However, I just want to sort of remind people that the virus doesn't jump off of a pen and get into your nose and cause an infection. It happens when you touch a surface and then you touch your face, and the virus can get introduced into your body. And so just like when you go to the market, keep your hands off your face because you're going to be touching stuff that's potentially contaminated. If it's not coronavirus, it could be staph infection or anything else. So, you want to keep clean. So, but then as soon as you're done, hopefully they'll have a hand disinfectant, by the door, and you can grab some on your way out. Or think about it before you go and bring a little bottle with you. And just when you leave the building, sanitize your hands so that, you don't accidentally touch your face afterwards. But no, I think it should be really safe, and I wouldn't worry about it. Obviously, vote by mail is a good idea. I do that, but sometimes I forget and I have to drop it off the night of, and that's okay too. I think you'll be fine. Whatever you do, vote.
Well, the good news is that in San Diego County and in Orange County, we've got options. If you're legally eligible to vote, you've got a number of ways to get your ballot to the registrar, and the ballots are going to drop in just a few weeks. And on October 5th, you'll be able to drop the ballots off at the Registrar of Voters in both San Diego and Orange counties. In San Diego counties, they're going to have drop-off locations open starting on October 6th. We'll have the list of those locations this week from the registrar, and we'll certainly I have those available on our website at mikelevin.org. In Orange County, they're going to also have the ballot drop boxes open throughout the county. You have all the way until October 19th to register to vote, or if you've got family or others that need to register, you're able to do that until October 19th. And then you're going to have, for the last few days in San Diego County, October 31st through November 3rd, and in Orange County, October 30 through November 3rd, there will be in-person locations throughout those counties, throughout our counties, where you can drop your ballot off in person. The idea here is that you don't have to sacrifice or choose between your health and casting your vote. I also encourage everybody, because of the issues that we've heard about with the U.S. Postal Service, although I don't anticipate those issues so much in our counties as perhaps in some other states or areas of the country, if you are going to vote by mail, get those ballots in as early as you can. And if you can use those drop-off locations or those collection centers that are set up by the registrar directly, probably a good idea to do so rather than to rely on the U.S. Postal Service, particularly towards the end of the election. So that's my 2 cents on voting. But yes, we want to keep everyone safe, and I know we can do it, and we will do it. Art in Oceanside asks, I appreciate that you've had many fundamental issues to deal with. I'm also concerned that we have the ability to hear live music again once we approach normal. Thank you for your co-sponsorship of the Save Our Stages Bill, H.R. 7806, towards that end. What is its status and what is being done to keep focus on it? Laura, thank you for that question. And for those that don't know, this bill authorizes SBA to make grants to eligible live venue operators, producers, promoters, or talent representatives to address the economic effects of COVID. The bill was introduced by my friend Peter Welch from Vermont. We have over 100 co-sponsors, and it's been referred to the House Small Business Committee. And my great hope is that we can work to get that bill as part of a larger COVID relief package to help our live music venues. Thank you for the question. Here's one for you, Doctor. This is from another teacher here in the 49th District who writes, I'm a 5th grade teacher going back to school soon. Should children be maintaining 6 feet between each other? We're being told that teachers should be 6 feet from students, but that kids don't necessarily need to be that far apart from each other.
This goes back to everything that I've been talking about so far. First of all, thank you for your service to our kids. My wife is a 6th grade teacher, and I know how committed teachers are and how stressful this can be for teachers to know what's the right thing to do. And a lot of our teachers have kids of their own. So it's a tough time, and I really understand the importance of this question. So physical distancing is important, but it's only one factor in the equation in trying to reduce the risk of coronavirus infections. So let's take a look at some of these factors. So first, we talked about how the virus can travel short distances on larger droplets that are expelled when people cough or talk or sneeze or even breathe. And these droplets carry the most virus, so the highest concentration. And so that's why we want to think about that 6-foot distancing. You know, if you're within that 6 feet, you're more likely to come in contact with some of those droplets that somebody's creating, and they have more virus in them, and you might become infected more easily in that in that zone. However, we can't ignore that. There's also the aerosols that travel further, and this is why the ventilation system in the room is important. So you want it to know, is the ventilation system, has it been checked? Is it up to date? Is it actually, is the air being filtered through a filtration system like a HEPA system that has a rating of either a 9 or a 13 MERV? MERV is the acronym, and it stands for the amount of filtration. And also, does that ventilation system bring fresh air in as well as circulate the air that's in the room? So it doesn't matter if you're cooling off the air and making it comfortable if it's the same air that you're continuing to circulate. You want fresh air coming in. And so if another way to improve that is to have a fan either in the window or the door that's blowing fresh air into the room. But you do have to be a little bit careful because you want to make sure that the air is blowing maybe towards a wall and not towards the children, and then from those children to other children. So you don't want to create a draft that's going to spread any infection from one kid to another. And then, another option is to bring in an air purifier into the room. They sell them at Home Depot. You can get them online. They're different sizes depending on the size of the space that you're in. They make them small enough that a teacher can put it on their desk so that they're sort of getting some clean air, or they can buy one that's big enough to purify the air in the whole room. And I think that that's not a bad idea as an addition to the air circulation from the ventilation system. And then again, masks are also important, especially in closed rooms, because they reduce the amount of virus that gets released from somebody who might be infected and doesn't know it, as well as it can block, 40 to 60% of the virus that might be inhaled that's circulating in the air. And then finally, there's some evidence, as I mentioned earlier, that the amount of virus that's inhaled is related to the severity of the disease. So even if you can minimize the amount of virus that's being inhaled, it can actually reduce the severity of the disease. So all these things, it's not black and white. There's not going to be a you're safe, you're not safe. It's all sort of degrees of gray. And the idea is to do everything you can to minimize the risk as much as possible and do the best that you can.
Thanks for that.
Yeah, the evidence as to why it's important for our kids to be in school is overwhelming. It's important for the economy, for the society, for the kids' development. There's lots of reasons to want to keep our kids in school. So it's worth some sacrifice, but I think that there's a lot that we know about the virus now that we can do to help to minimize that risk.
Thanks, Doctor. Bonnie in Carlsbad asks, are you co-sponsoring the Delivering for America Act? We must protect the vote. We feel fortunate to have you in the 49th. Thank you for all you do. Well, thank you, Bonnie. Yes, I was a proud co-sponsor of the Delivering for America Act. That was the bill that we flew back to D.C. to pass a few weeks ago. That would provide the $25 billion lifeline to the U.S. Postal Service and also undo the damage being done by Louis DeJoy as Postmaster General. And it's truly unfortunate that that bill, after passing the House, can't even be heard in the Senate because McConnell won't move it. But make no mistake, Louis DeJoy is deeply conflicted as Postmaster General. We know about now this story that's come out around the campaign contributions that he may have illegally bundled or refunded from his employees. So I've been calling for weeks now for him to be removed as Postmaster General. And moreover, we know that the USPS needs a lifeline right now. And I think we're going to continue to do everything we can. I led a letter of 137 of my colleagues, bipartisan letter, to support that lifeline. We got it in the HEROES Act, and then we passed it separately in the Delivering for America Act. So we're going to keep at it because we've got to, protect the USPS. Absolutely. Here's one for you, Doctor, from Benjamin in La Jolla. I keep hearing that the coronavirus has mutated and now it's less deadly, but more contagious. Is that true?
So it's interesting with mutations. There's probably a longer answer here, and I'm going to go for the shorter answer for the sake of time. All viruses do mutate. There are mutations, but mutations can make things, it can make a virus more virulent or less virulent. It can make it more easily transmittable or less easily transmittable. So hearing that a virus mutates shouldn't be an automatic assumption that it's now worse. It could sometimes actually make the viruses, like Benjamin said, less contagious. In this case, Dr. David Montefiore, who's a virologist from Duke, who was working with Dr. Korber from Los Alamos Laboratory, who's a biologist, and they actually, had done a lot of work on this same issue for HIV. And so this doctor looked at at whether this was happening with coronavirus, and they basically came to the conclusion that the coronavirus is mutating less rapidly than even the HIV virus. So it's not a rapidly mutating virus. But the thing that I think is triggered this concern about the mutation is that there was a mutation discovered by this team. It's called the D614G mutation, and it's a simple mutation that affects the spike protein. And the spike protein is the protein that actually attaches to a cell and helps it to get into the cell and causing infection. And what they were finding was that this mutation was showing up in more and more samples from around the world. And so their concern was that this was a rapidly spreading mutation, and there was some concern. And when they really sort of look back at it, this is really just natural selection. Mutations occur. The ones that have mutations or strains that are easier to transmit or survive longer are the ones that basically spread. The other ones die out and they don't go as far. And so what we've just seen is the natural selection process in action. And that particular strain is the one that's now the predominant strain in Europe. It's here in the United States. It's common in Canada and Australia. And it's the strain of the virus that happens to be the one that everybody's getting. It doesn't mean that the virus is changing rapidly and that we're going to have a super bug on our hands anytime soon. So it is true. There's mutations. I think it's not something that we need to worry too much about. I think in all the research on the vaccine development, a major issue that they look at is mutation and how rapidly viruses mutate, because they don't want to make a vaccine that is not going to be effective for very long if the virus mutates. So I think this is always a possibility, but it's not something I would worry too much about.
Wow, thank you. Zach in San Clemente says, I'm concerned with the recent nuclear waste dumps happening for medicine. Is there anything we can do to stop that? And what is the risk of allowing it to continue? Well, Zach, you're correct that there have been some radioactive dumps into the Pacific Ocean. I immediately asked my team to look at this very carefully. And one of the things that we've learned is that it actually used to be far more radioactive material going into the ocean when the plant was up and running, was an operational nuclear power plant. But make no mistake, this is just another example of why we must get that waste off the coast permanently. And as I've said all along, and of course we have our report of the SONGS task force, which if you haven't read, I hope that you do. It's about 70 pages and it's worth checking out. And even if you just read the executive summary, you'll see that getting the waste off the coast quickly and safely is really a symptom of a bigger issue or indicative of a bigger issue, which is that we lack a comprehensive strategy to deal with spent nuclear fuel throughout the United States. And we have 8 different things that we're working on at the federal level to try to move the needle. And we're making progress on all 8. I'm really encouraged by that. Of course, we introduced the Spent Fuel Prioritization Act, which says for all of the nuclear sites in the United States, about 130 of them, move the waste first from those sites with the highest seismic risk and the highest population density. So we're going to do everything we can, working with anybody that'll work with me, Republicans, Democrats, senators, other House members, to get that waste off our coast. It's a top priority, and more to come on that topic. And thank you for the question. Here's one for you from Jacob in Mission Viejo. Another interesting question, doctor. Is it true that sleeping on your stomach helps if you have COVID-19? And if so, could sleeping on your stomach reduce your chances of catching it in the first place?
Well, that put all kinds of images into my head about ways that you can avoid breathing on somebody when you're sleeping, but I don't think that's really what the question is about. So it's true that placing hospitalized patients on their stomach, which we refer to as the prone position, can help to distribute oxygen more evenly around the lungs. And that's because when you're on your back, the weight of your body presses down in your lungs and compresses part of the lungs. So by turning over in your stomach, it actually opens up the rib cage and the lung in the pleural space so that you have room to breathe, and it makes it easier for the oxygen to get into the lungs. That doesn't have any effect on whether or not you can become infected, though. So sleeping on your stomach won't prevent infection, but if you happen to be infected, it's a good way to help the lungs to get more oxygen.
Sounds like probably not the best strategy to beat COVID-19, but
well, I guess if you stay in bed all the time on your stomach, you're not going to go out and get infected, right?
There you go. Patricia in San Juan Capistrano says, or asks, do you support desalination plants? What are you doing to mitigate the horrible consequences of desalination in the ocean? They would have to be very small desalination plants. Well, we've got the biggest desalination plant in the Western Hemisphere in Carlsbad. It was 50 million gallons a day. Now it's being expanded to 60 million gallons a day. I am a supporter of desal if it is done in an environmentally responsible way. And there's innovation going on all the time, both with regard to how the effluent is impacting marine life, as well as the power generation that's being done to generate the electricity necessary. But make no mistake, the resiliency of our water supply is so important, particularly in Southern California. And I think, we don't need to go through the history of water in California, but this is something that has been a huge issue for decades and decades and continues to be for as long as we have California with such a huge population density in the south and many of our water sources in the north. This, goes back to Pat Brown and his days with the California Water Project. So yes, I have the Desalination Development Act, which provides more money to desal, but only to those projects that are done in an environmentally responsible way, using the best practices. And I have really been encouraged that we've had good bipartisan support, including my friend Jared Huffman, who chairs the relevant subcommittee that I sit on, the Water, Oceans, and Wildlife Subcommittee. I've also been honored to get to go and see some of the even bigger desal plants than the one in Carlsbad. I visited Israel, and they have a huge percentage of their water that they get. I believe it's 28% that they get through desal. So it's certainly not perfect, but as part of a resilient and diverse water supply, I think it's important. Here's a question for you from Bert in San Clemente. Do you think the new color-coded grading system for each county in California is accurate and reliable?
So I'm not exactly sure what accurate and reliable is referring to, but let me speak a little bit about what the blueprint for a safer economy is. The state decided to simplify the previous county monitoring system by reducing the number of metrics that it was calculating down from 6 to 2. And instead of creating it's created a 4-tier system to basically say whether the spread in the community is, high, medium, low, or less. And the metrics that are being used now are, one is the number of infections per 100,000 population. So how many people in the community out of 100,000 people in the population are testing positive. And this number is sensitive to the number of tests that are being done. So this is what the president refers to when he says, we want to get the numbers of coronavirus cases to come down, so let's do less testing. And that's what will happen. You'll get fewer numbers of cases because there could be fewer numbers of people detected. The second number is the proportion of the tests that are positive. And this number is sensitive to who's being selected for testing. So if you're testing people who are symptomatic only, then the proportion that are going to test positive is going to be higher because you're not testing asymptomatic people. And unfortunately, that's the recommendation that came out of the CDC to stop testing asymptomatic, so we could actually see that proportion rising because we're selectively testing people that are at a higher risk for infection. Now, that's not a bad thing. We want to test people who are symptomatic and are positive. The problem is that we're going to be missing all those people who are spreading the virus and don't even know that they have it. In a way, people that are sick are going to go home and they're going to lay in bed. They're not going to spread it. Whereas it's the people that are asymptomatic and don't know that they're infected that are going to be the bigger spreaders. So the way that it works is that if one of the two metrics is higher than the other, so one of them is a percentage, one of them is a rate, then what they'll do is they'll go with the one that's higher in determining what tier the county is in. And so in this 4-tier system, the purple tier or tier 1 indicates that the virus is spreading in the county with more than 7 cases per 100,000 residents, or more than 8% of those tests come back positive over a 7-day period. The red tier, or tier 2, indicates that there's substantial spread in the community, while the orange tier, or tier 3, indicates moderate, and the yellow, or tier 4, indicates minimal spread in the county. Right now, as the congressman had mentioned earlier, we're in the red tier, or the substantial spread tier, which is better than the purple tier. As of September 1st, when this first came out, 38 counties in the state out of the 58 counties were in purple. And thank goodness, San Diego and Orange County are the 2 counties in our region that are in red. And we hope to keep it there and hopefully get lower. But all it will take is, people going back to bars and restaurants and not wearing masks, and we're very close to crossing that line, and we could end up in the purple tier. Now the problem is once you get in that purple tier, then it reflexes to all kinds of activities, such as shutting down businesses, shutting schools down again, and basically making it harder for the economy to come back. So we're in a better place than some counties, but we're on a threshold, and we need to be really careful to make sure that we're not crossing that line. And one point I wanted to make earlier, going back to the schools, is that it's so important that teachers and students in the school are doing everything they can to try to prevent transmission in school. But I think it's also really important that we protect each other at home and in our communities as well. Because if we send our kids to school with coronavirus because we took them out to a birthday party the weekend before, or went to a movie or something, those kids are going to bring it to the schools, and then it's going to spread in the schools, and that's going to have a bad impact. The other thing I think is really important, as I think about how I would have behaved when I was younger, or my kids, is that if I'm only wearing a mask in school, then I don't have to wear it at home or when I go out with my friends, then school is going to become this terrible place where you have to wear a mask. And I think that's the wrong message to send to our kids. I think it's really important for parents to make sure that they and their kids are wearing their masks when they go to the grocery store, when they go to visit, family members, when they're out of the house. Do it because it's the right thing to do, and it sends a better message so that when they're in school, it makes it easier for those teachers to enforce that behavior without having to fight those kids. So we're all in this together. Let's pull together and do it.
Well said. Well said. We have one more for you that I want to make sure that we get to before we have a hard stop here. This is from Steve in Dana Point. I saw on CNN that the drug remdesivir is in limited supply in the United States, but is readily available around the world. How is that even possible?
Well, this is not a totally unique situation. India is the biggest manufacturer of generic drugs in the world, and we actually get a lot of drugs from India. And so it's not totally surprising that other places have more of the drug. But the company that makes remdesivir is a company called Gilead, and they're located here in the United States. And they have a patent on remdesivir. So they're the only company that can actually sell this drug in the United States. There is no generic for remdesivir available in the United States right now. Now, the Trump administration has the ability to open up those patents. They can go to Gilead and say, we need this drug, and you've got to make it available, or you have to let somebody make a generic of it. And that's a possibility. But at this point, the number of cases in the U.S. is coming down, and there was concern that we were getting to a point where hospitals didn't have enough remdesivir available for their patients, and doctors would have to decide which patients would get it and which ones weren't. But because the number of cases is starting to come down, which is a good thing, the supply seems to be meeting the demand. So I don't think we're on that precipice right now. The other thing to keep in mind is that remdesivir was found to shorten the length of hospitalization in severely ill patients. But in the trials that were done, it didn't change the overall survival of patients with coronavirus. So it is a good drug. It has its purpose, but it's not a magic bullet. This isn't the drug that's going to save the day. So I think it's good that we have it available. I think the doctors are using it appropriately, but we still need to work hard to find some other therapies, some other drugs that work better, and to figure out how's the best way to treat patients.
Well, Doctor, it's about that time. I want to thank you again for joining us, and I wanted to give you a chance for a closing statement this week.
Yeah, there's so much to talk about, and I'm not going to harp on mask wearing again because I think I've made that point. So I'm going to go back to something that you said because it's a little more fun, which is we need to support the arts. And I love the fact that we've got a bill to support our musicians. I think it's really important because, you know, a lot of them are struggling, and we all, you know, benefit from all that free music that we get on the internet and, you know, on our other services. So I'm going to put in a plug for supporting the online concerts that you can get. So the Belly Up has concerts every week where you can actually, the musicians go in and they perform live to no audience, and we can watch it online, and it's only a few bucks to watch those concerts. They're actually really good. You can actually hear the musicians playing as opposed to hearing everybody around you screaming. So it's kind of nice. And I know there's a place in LA called the Baked Potato, I believe, that does them as well. Really good jazz music. They're out there. Look for them online. That's a great way to support our musicians during the pandemic, and we'll keep them viable until it's safe to go back to concerts live. And in the meantime, we're going to do our part to not go to those group gatherings and keep each other safe.
Well, that's a great suggestion, and I look forward to the day we go back to the Belly Up and actually hear some live music there again in our great Solana Beach venue and all the other great live music that we have here in the 49th. But a terrific suggestion, and proud to support the arts. We have 9,000 creative professionals in the 49th district, and I know a lot of them will appreciate your comments, Doctor. I thank you again for being here for number 15. And I would be remiss if I didn't thank our team again. Everybody working so hard during this crazy time. And if you're interested in volunteering, the election is only 52 days away, and the ballots will drop in 3 weeks. We're going to do everything to keep our volunteers safe in accordance with the public health recommendations, including from Dr. Garfien, who I turn to for his expertise about how we ought to be keeping our volunteers safe during this time, not to mention our constituents safe during this time. So with that, Doctor, I thank you again for everything. I'm grateful to my family during this time. And again, happy birthday to my dad, who I'll be seeing here in about a half hour. I hope everybody stays safe, stays healthy. I'm thinking of all those impacted by the wildfires and everybody else impacted by COVID. So until we see you for our next town hall, number 41 is in the books. Thanks again. Have a great week.